Hi everyone, this is Ismael Gestopa. The title of this presentation is Sleuthing Journal, Los Angeles County, California. The LA County has a lot of community health centers that serve its people, but there are also a lot of private health centers that serve the underserved community, and one of these is the First Aid Urgent Care where I work. First Aid Urgent Care in Panorama City provide San Fernando Valley and the Los Angeles County with high-quality care and friendly services. Providers are accessible to non-residents throughout California. With its second location in Van Nuys Boulevard, Panorama City, California, it provides the community with access to care for general illnesses, infections, minor injuries, and health concerns. First Aid Urgent Care accepts all insurance plans, including Medicare, and treats patients of all ages. Employees can receive on-site vaccinations, drug testing, employments, physicals, and treatment for work-related injuries. Our local public health services. Our integrated health system provides exceptional care to enhance the health of patients in the community. Administer 26 health centers and 4 acute hospitals to treat juvenile justice system youth and inmates of Los Angeles County Jail. Health services treat 750,000 patients annually, employs more than 23,000 individuals, and has an operating budget of $6.2 billion, the second largest municipal health system in the country. Through academic partnership with UCLA, USC, and CDU, health services hospitals educate doctors in nearly every medical specialty and subspecialty. In addition to clinical services, we manage the Los Angeles County AMS agency and the 911 emergency response system, housing for health, and the Office of the Diversion and Re-Entry, which assists vulnerable populations such as those released from prisons and institutions in locating housing with supported services. For the vaccination rates, get vaccinated. Vaccines against COVID-19 prevent severe illness, hospitalization, and death. Vaccination may also reduce your risk of transmitting the disease, thereby protecting those people around you. Vaccine production is widely regarded as one of the most significant achievements in public health. Vaccinations such as these protect children from contracting vaccine-preventable, potentially life-threatening diseases. The state of California is continuing its efforts to increase the proportion of 19 to 35-month-old children who have received the most recent vaccination. False information and fears regarding the long-term effects and dangers of vaccinations are one of the most significant obstacles preventing California from reaching its 80% vaccination target by 2022. Despite recent obstacles such as public demonstrations, parents, those who provided child care, those who provided medical care, and other stakeholders have made and will continue to make significant progress. In 2010, the baseline year, 54.1% of 19 to 35-month-old children had received all recommended vaccinations. According to the most up-to-date data that has been compiled, 68.6% in 2017. We have set an objective of 80% or higher and intend to reach it. In accordance with the Social Vulnerability Index, Los Angeles County is one of the most vulnerable regions. The county has a vaccination rate of 82,636 per 100,000 residents against COVID-19. When vaccines became accessible in Los Angeles County, some parents rushed to vaccinate their children after a surge immunization rates for children fell locally and nationally. As of mid-March, 30% of 5 to 11-year-old in Los Angeles County were fully vaccinated, compared to nearly 80% of adolescents and adults. According to federal data, despite a record number of COVID-19 related hospitalizations for children during the Omicron wave, the numbers have remained stagnant nationwide. Asians have the highest vaccination rate of all ethnic groups, followed by Black or African Americans and Hispanics or Latinos. Despite this, it is not surprising that the highest portion of the Hispanic or Latino population is also the highest proportion of the vaccinated population. For the disaster planning, in January 2013, Los Angeles County saw the formation of 16 community coalitions, including 8 community resilience coalitions and 8 preparedness coalitions. All coalitions are facilitated by public health nurse, community liaison nurse, or health educator and receive $15,000 annually to become $15,000 annually to advance community resilience preparedness initiatives. All coalitions develop a yearly work plan that connects with activities to outcomes related to the coalition's overall objectives. LACCDR project partners support coalition by providing technical assistance and resources to complete activities. All Preparedness Coalition began with workshops based on the Emergency Survival Guide for Los Angeles County, individual and family preparedness, vulnerable populations such as children, the elderly, people with disabilities, and animals, communication tools, and connecting with local nonprofits, religious organizations, and small businesses were all the workshop topics. The County of Los Angeles takes an active role in the promotion of its services on social media platforms such as Twitter in order to guarantee that the residents of the county will be adequately informed and equipped with the appropriate preparedness for emergency management. For health education and promotion, residents of Los Angeles County can access services related to public health, and thanks to the efforts of the Los Angeles County Department of Public Health. Barbara Ferrer is the Director of the Department of Public Health for the County of Los Angeles, while Munto Davis, MD, MPH, is the Public Health Officer for Los Angeles County at present. The county's Department of Public Health does an excellent job of spreading awareness about current illnesses and diseases through their health promotion efforts. They serve as a means of communicating accurate information regarding the aforementioned diseases, and they are placed in key locations and prominent platforms. Now, infectious diseases such as impacts in COVID-19 are at the top of the priority list, along with commonly abused substances such as fentanyl and flavored tobacco. For community engagement, the objective of community engagement initiative in Los Angeles County is to increase the number of individuals with health insurance. The organization focused its efforts on achieving its mission through the community's active participation and empowerment. LA Care Plan is the largest publicly run health insurance program in the United States, covering our 2.4 million people. LA Care offers 4 product lines, with the most notable being medical and LA Care Covered, which are sold in the Affordable Care Act's exchange. The mission-driven healthcare system prioritizes healthcare quality, access, and inclusions, and is committed to advancing health equity. As reflections, the condition of the County of Los Angeles health programs for residents has improved. Collaboration is essential to the success of several health-related programs, especially those that emphasize resilience and disaster planning. Additionally, all age groups now have access to public health services. These services are consistent with the national objectives of achieving a healthy population size. That ends my report, and these are the references. Thank you. For community engagement, the objective of community engagement initiative in Los Angeles County is to increase the number of individuals with health insurance. The organization focused its efforts on achieving its mission through the community's active participation and empowerment. LA Care Plan is the largest publicly run health insurance program in the United States, covering our 2.4 million people. LA Care offers 4 product lines, with the most notable being medical and LA Care Covered, which are sold in the Affordable Care Act's exchange. The mission-driven healthcare system prioritizes healthcare quality, access, and inclusions, and is committed to advancing health equity. As reflections, the condition of the County of Los Angeles health programs for residents has improved. Collaboration is essential to the success of several health-related programs, especially those that emphasize resilience and disaster planning. Additionally, all age groups now have access to public health services. These services are consistent with the national objectives of achieving a healthy population size. That ends my report, and these are the references. Thank you.